So I do think housing is healthcare. You can see that I'm dressed in my scrubs. I'm about to walk across the street to my office and see patients at the hospital. And in many ways, I more and more think that the best prescription I can write is for a stable, decent, affordable home. And unfortunately, we don't stock that at the hospital that I work at, Boston Medical Center. But these are ways in which we can work with policymakers to make sure that every family has access to that stable, decent, affordable home. In a lot of ways, I think that unfortunately today we know that there is not the same fair and equitable access to that. And so we know that that causes unnecessary health problems. When we think about what quality means, often I will treat kids with asthma that are suffering and having asthma attacks because they're living with chronic mold or they're living with cockroaches and mouse infestations. Oftentimes the clinic I do is the grow clinic for kids that are failing to thrive, not able to grow like you would expect. And oftentimes when I really ask families, sometimes their kids aren't growing because they're having to choose between their rent costs and their food costs. I think lastly, I have a lot of families that live in neighborhoods that aren't really that safe. And so one of the things that can be the hardest thing to talk to families about is the lack of safety in their environment, and not being able to have access to neighborhoods that are safer is something that many of my families face. I'll give you an example of a family that I treated where they were able to actually see that improvement after they were able to move into a safe, decent, affordable home in a neighborhood of opportunity. I was treating a 4-year-old child that was actually closer to the size of a 2 or 3-year-old. And his mom was working 2 different jobs, and they were really struggling to keep up with the rent, and she was barely able to afford childcare. In fact, she was in a pretty substandard childcare environment. And she, in many ways, won the lottery. She got the Section 8 voucher that she had been waiting for years. And she was able to get a neighborhood in the suburbs to accept her affordable housing voucher. And what ended up happening was really amazing. She was able to live in a neighborhood that was quiet. She was able to have her child play outside. She was able to now not have to choose between rent and eating. She was able to actually take on a more consistent schedule because she was actually eligible for some of the childcare in that community. And this kid just started thriving and started talking and started knowing his colors and was ready to start in kindergarten, and we graduate that child from the Grow Clinic. And that to me is what this means, is that the federal government, if we're able to do fair and equitable investments in housing, that child's not going to be the exception anymore. That child's going to be the rule. And this is how we're going to be able to work together in order to make sure that housing is healthcare for everyone. Thanks.